So we've talked about our four key principles of lips together, tongue on the roof of the mouth, teeth not clenched, and healthy breathing out of the nose. One of my main goals with our initial assessment and treatment is trying to help guide somebody to breathe out of their nose. And maybe the only treatment, that, I offer is just screening you and, referring you to an amazing ENT that can help, open up your nose so you can breathe out of your nose. But what we know is if our lips together and we're breathing out of the nose, that equals health. We should be like that over 95% of the day. We're the only, mammal that's walking around on this planet that has our mouth hanging open. We sleep with our mouth open. We're snoring. And if you look at any other mammal, and that's always a fight or flight response. It's like you're getting chased by, a lion. So it equals stress. It equals anxiety. It equals dry mouth. Mouth breathing, equals, cavities or snoring or kind of gritting our teeth together. So, what we are learning more and more, in dentistry is that if we can help guide someone to keep their lips closed and to breathe out of their nose, that we'll be able to offer more prevention and help with more permanent treatment. At the end of the day, a lot of the symptoms or disease that we see are airway driven, and they're airway driven because the skeleton is too small, or you don't have a learned habit, from a childhood of breathing out of the nose. So, sometimes it can be structural, helping people, breathe out of their nose. Like I mentioned, seeing an ENT. Sometimes it can be an expander on a kid to grow jawbone and guide the growth of their jaw to be big and the foundation, of the nose to open to decrease airflow resistance. Sometimes we can offer and teach people and guide them on lip taping or mouth taping. I know it sounds crazy, but we can work into doing that. We guide people on using saline rinses to flush and clean out the nose and diminish any bacteria. Focus on healthy breathing tips and breathing practices and mindfulness, and all of those things can play a role in helping us achieve nasal breathing. But that is one of the most important roles and aspects that we try to help provide people here in the office.